All right, so now we are live. Hi, everybody. Thank you so much for joining us tonight. Tonight we have a Q&A session with Dr. Kahng, and we're really happy to have you here today. But before we begin the session, I just want to say really quickly, this session is a little bit different from the other sessions we've had. This one's going to be more of a Q&A session, so we're not going to have a quiz for this session, but we will have quizzes for the rest of our sessions. It's just this one's more of a Q&A, so it's just a little different. And we're gonna get started with some questions if Dr. Kahng is ready.
I'm ready.
All right, Dr. Kahng. So we got a lot of questions in our our Instagram story. So a lot of questions were about the differences between private practice and corporate practice and like disadvantages and advantages of both.
Okay. Hello, everyone. Thanks for having me. I think I'll just give a little bit of background as to who I am and my experience in dentistry so that you guys can just have a better understanding of where I'm coming from. So my name is Dr. Joyce Kahng. I'm a cosmetic dentist in Costa Mesa, California, which is like the Orange County area. I graduated from UOP Dental School back in 2010. And I did the 3+3 accelerated program. So I kind of shaved off 2 years there. And then I was able to graduate as a dentist when I was 23 years old. Then I went to residency. I did a general practice residency at Jacobi Medical Center in New York, which is a level 1 trauma center. After that, I started just practicing dentistry as an associate in New York City in Manhattan. And then I met my husband, moved back to California, and we basically like started our careers here. My husband's also a dentist. He works for PDS, or he's a part owner in the PDS franchise, or whatever you call it, corporate. And I saw that you had Dr. Rita Garabet. Is that?
Yes, we did.
Yeah, so I taught her at USC, and she's actually in the same corporation. So
oh, that's cool.
I opened my practice here, and then I also taught at USC Dental School from 2014. I started off as an adjunct faculty, and then I became a part-time faculty until just the beginning of this year is when I actually left to go more full-time with my practice, and I'm having a baby and all that. So my practice is a little unique compared to a lot of other practices. And I think that's what's really fun and cool about dentistry is you can make your practice however you want it. Mine is mostly just focusing on specific procedures. So I don't do like extractions and root canals and everything under the sun. I do very specific procedures, obviously prevention to keep everyone nice and healthy and clean, keep their teeth clean. A lot of restorative, which are like fillings and crowns, and then cosmetic dentistry as well. So just those few things. What was your question again? It was about corporate dentistry versus private. Yes. Okay, yeah. So I don't know how much you guys know about private versus corporate. I have a private practice, and then I guess the biggest difference is kind of like ownership. So I own 100% of my private practice. And that means that like if the toilet breaks down versus private. Oh, okay. Yeah. So I don't know how much you guys know about, I muted myself now. Okay. So like if the toilet breaks down, that is my responsibility. There's nobody else who will take care of that for me because I own the practice. There are different ways to do private practice. Obviously, like you could have a partner, and then like I have an associate who's another dentist that works for me, but she doesn't have an equity stake in my practice. So that's like the big difference. With corporate, most of the time, and those can be done in many different ways as well. But with PDS, especially, a portion of it is run by the corporation, which are non-dentists. And then the other portion is run by dentists. So kind of like the clinical portions are run by dentists. And then the non-dental portions are like the administration, the marketing, and all that stuff that you really don't learn in dental school. So I think corporate dentistry sometimes gets like a bad rap, but we sometimes don't go to dental school to learn how to be a business owner, you know?
Mm-hmm.
My husband happens to really like his whole situation in the corporate world.
That's good.
Let's
All
see.
right. So, yeah, I'm just going to keep going through my list. And then after that, we can take questions from the live stream chat. So, a lot of people were asking about the difference between cosmetic dentistry and general dentistry. But from what you described, it seems like they're very similar.
Yeah, so I think that's a really common question to get as well, not just from people who are going into dentistry, but like everyone, like general public.
Mm-hmm.
As you guys know, with dentistry, you can do more education to become a specialist in something. So if you want to be a root canal specialist, or you want to be a prosthodontist, or like a person who takes out teeth, an oral surgeon, you can do extra training for that. With cosmetic dentistry is actually not a specialty of dentistry. So as a general dentist, we are able to do all the specialty procedures. So as a general dentist, I could do root canals, extractions, work with kids. I could do all of that stuff. I'm not limiting my practice or scope to just one thing anymore. With cosmetic dentistry, it's just an avenue of doing general dentistry. I think that when you become like a cosmetic dentist, it's kind of like a way of marketing yourself because you enjoy doing those procedures over other things. So like I was saying in my practice, I don't do everything. I only do the things that I want to do, which are restorative, like high quality restorative dentistry, and cosmetic dentistry. And I just find that I'm the most happy when I do those because those are the things I'm good at, and I just like enjoy doing those things. So when I started off in my like whole journey of being a dentist, I didn't start marketing myself as a cosmetic dentist right away. I didn't know if I wanted to be a cosmetic dentist. You have to start doing some of those procedures and seeing if that's something that you're good at and that you like, because the thing with cosmetic dentistry is that you have to have some sort of aesthetic eye. It's not just like you're drilling a hole in a tooth and filling it full of composite. You have to have a kind of like a character or personality when you're delivering your cosmetic dentistry. And so if a patient came to you versus another cosmetic dentist, they should be able to expect a different type of result because of the nuances of aesthetics.
That makes sense. Thank you, Dr. Kahng. And I have a question about dental school. And so you mentioned you went to the 3+3 program at UOP. So there were a lot of students who are applying this cycle and they wanted to learn more about your experience in dental school.
Okay, so with the program that I did,
Yes.
accelerated program. Okay, so I did the UOP 3+3 accelerated program, and that is straight out of high school. So if you're already in college, I think it's a little late to join that program, but you apply straight out of high school, and then they'll place you in either a 2+3, 3+3, or a 4+3 program. What that really means is the first number is how many years of undergrad you are going to do on their Stockton campus. And then the other number, which is 3 all the way around, is how many years you'll spend at the San Francisco Dental School. So one of the unique things about University of the Pacific is that it's a 3-year dental school program. And this program is really, it's kind of awesome if you know that you want to be a dentist. It's a compromise though, if you don't know for sure, because it's a commitment, going right out of high school and straight into a accelerated program. Like what if you end up not wanting to be a dentist? Like couple years into college, you have to sort of like, you went to this one college so that you could be part of this program, and then you decide you don't want to be a dentist anymore, and then you have to switch gears totally when you could have gone to another college that may have been a better fit. So that's what I mean by it's sort of a compromise. You have to be pretty committed to it. But so just going back, I did the 3+3. So I did my undergraduate training. I got my biological sciences degree in 3 years. And then I went over to the dental school. The pro about this whole program is that if you did your 3 years of undergrad and you hit a certain DAT score and you hit a certain GPA, you are offered a guaranteed interview to the dental school. And it does not mean that you are guaranteed admission. It just means you are guaranteed an interview. Now, if you guys have been researching a lot about dental schools, you'll know that UOP is a very competitive program to get into if you are not part of this accelerated program. So getting that interview is like clutch. It's really, really nice to get a guaranteed interview there. And honestly, as long as you don't screw up your interview and as long as you hit all your criteria, you are pretty much going to get in. The only times you don't get in is if you let's say that you got a bad grade or you got a bad grade in one of your final classes and you had already been accepted, they won't accept you anymore. Like they're really actually strict about their rules.
Mm-hmm. That makes sense. So I'm going to see if there are any questions in the chat related to what you have been talking about. So I see more questions about dental school. This is kind of a heavy one, but what do you wish you knew before dental school?
What do I wish I knew before dental school? I actually think the amount that I knew, which was like nothing, was kind of a blessing because I thought dentistry was this one thing this whole time. And this is what's so hard. I know you guys are doing like shadowing and like talking to dentists. Even if you shadowed 1 million hours in a dental office, you would not be able to extrapolate that and figure out whether this is a good profession for you. That's one of the things that's really hard because it's not just a matter of observing and seeing if you like the environment. Those things are really important, but also seeing if you're good with your hands, if you like working with people in the capacity of like this tiny little area. I think for me, one of my saving graces of this whole profession is that I really was so naive and I didn't know too much. And that's not something that I recommend for everyone. Like, I'm really happy that everybody is doing their due diligence before going into this profession because it is freaking expensive these days to go into dentistry. So good for you guys.
Also on that note, I had some questions about before going to dental school, people who take gap years and what you would suggest for people who take gap years.
I think it really depends, like a gap year. I think that's great. Like it depends on your personality. For me, when I want something, I'm so tunnel visioned on wanting that and like wanting it right now. So if I had done a gap year, I think I would have kind of I would be distracted. It would be a distraction for me. But there are things that I really wish I did. Like, I don't think I needed to go through school that fast. And I think a gap year is a great opportunity to get to know yourself better. Remember that we are, I'm a dentist. You guys are pre-dental, right?
Mm-hmm.
But beyond that, you guys are also people and you're figuring out what you want to do, not just in the capacity of dentistry, but as a person. So like that would be a great opportunity to do other things that are not dental related and like travel abroad. I wish that's something that I totally wish I did.
Mm-hmm. That's a good point. Let's see. So what does your day look like as a cosmetic dentist? What does your usual day look like?
It really depends on the day. So my day is very different depending on like even between like a Tuesday and a Wednesday in my practice. On Tuesdays, it's just me, an assistant, and a front desk lady. And so we just go one by one through the patients. And it could be like a full day of just doing new patients. It could be a full day of just seeing like one large case. It really, really depends on what's scheduled and what the patients want. I'm hoping that in the future, I'll be able to kind of consolidate what days I do certain things. Like, for example, on Wednesdays, I have a hygienist there. And so it's a little bit more busy. There's a little more traffic on those days. What I wanted to start doing is closing off like my Tuesdays and Fridays where I don't have hygiene so that I could just work on bigger cases. And so I don't have to be disturbed and go do hygiene checks and things like that.
Mm-hmm. That's interesting. And I have a quick question. What would you consider a big case? Like, what would that be?
That would be something where I would block off at least 4 hours for. My general rule of thumb is that I don't keep people in my chair more than 2 hours. 2 hours is maximum that I think that people can be comfortable for doing dentistry. And if I'm about to block off 4 hours, that's like an entire morning for me.
Mhm. So what kinds of cases would you be working on, like for 4 hours? That seems like a long time.
That means that I'm working on more than one tooth.
Oh,
Definitely
okay.
more than one tooth. So it could be like 6 veneers or more than that. If it's like 4 veneers, it's not a full morning. We could do that quickly, much more quickly. But like it would just be something where I don't want to really be disturbed.
Okay, that makes sense. Um, so I have some questions related to pre-dental things, like what would you recommend for practicing manual dexterity?
Oh, you could do a lot of things. Like for me, I always painted my nails.
Mhm.
Like that, I think if you're really good at doing small, meticulous things like that, even painting your nails, that's a sign of that you're good at aesthetics as well. You are always making your nails into different shapes, and then you're coating things. That's a lot of dentistry. I find that if you are good with nails, then you could be good at dentistry too. It's like you're looking at very small, detail oriented types of things. I've heard that even like playing video games is really good for your manual dexterity. I did ceramics. I think drawing is also good. Part of it is not just your hands, but it's also how your hands connect to the way that you see things. So that's why when you take the DAT, there's that perceptual ability portion. You have to be able to translate what you're doing with your hands and make it happen. That's the hard part. That's why
Mhm.
we always say manual dexterity is so important. But really, if you can't see it, your hands may be able to do it. But if you can't see it, then your hands won't be able to do it because you can't
Mhm.
direct your hands to do it. Does that make sense? I don't know if that
Yeah, I've seen like those activities where they, use a mirror and try to like do things looking through the mirror. Is that what kind of what you mean?
that was one of our first activities in dental school. Because I think what people don't understand is when we're working on upper teeth, we're using a mirror to do everything like backwards. And so
Mhm.
what they had us do was use a mirror and then write something out backwards. It's so random, but it's like a skill that dentists have. Or upside down is probably the better way of saying it.
Mhm. So this is another pre-dental question related to this pandemic that we're in. So what would you recommend to pre-dental students for activities during the pandemic?
Activities like,
Like how they could still, help their application for dental school.
huh. I guess there's no right answer or wrong answer for that because it's kind of unprecedented, right? I
Mhm.
think if even doing stuff like this is really good to write down because it's new, it means that you are adaptable to the times and that you're still you're changing the way in which something was done traditionally to make it work. That is really, really
Mhm.
important when you're a dentist. And it's not because it has nothing to do with like your actual skills as a dentist, but when you become a business owner, and I find that most people who want to be a dentist are thinking about private practice, you should be able to be adaptable with the times.
Mhm. That makes sense. And speaking of wanting to own a business, what do you recommend to dental students who, eventually want to own their own practice in the future, but don't have much business knowledge?
Oh, I would say don't worry. there, there is nothing I knew when I took over my practice. The one thing that I would say I had as an advantage is my mom, right? My mom was a dentist, but she's very hands off when it comes to my business. So I have a very different style of business than my mom. And it is nice to have her as like a resource, but don't let that deter you from from owning a business because you will figure it out. And these days there are so many more resources than when I was a dental student. Like if you guys have followed Ignite DDS or Dr. Paul Goodman on Instagram, they both have CE, like sort of CE or extra courses that can help you to understand the business. But the best thing that you can do is just do it. And then it's like your own MBA. You'll learn on the spot and you'll make a lot of mistakes, but you will learn it.
Best way to learn is experience, right?
Mm-hmm.
I have another question in the chat that says, do you think location affects your ability to pursue a career in cosmetic dentistry?
Ooh, that's a really good idea or question. I think that, I don't know, because I've only been in like Manhattan and California, which are very, very saturated. And I find that people in these areas do care a lot about what their teeth look like versus if you're like in the middle of nowhere, they may not care that much about cosmetic dentistry, but you also have less competition and less saturated with cosmetic dentists. So I follow some cosmetic dentists on Instagram and they work like literally in the middle of nowhere and they get tons of cases. So I don't know how to answer that question fairly. But I think you could do cosmetic dentistry anywhere. You might get it might be more fun to do it in like this type of area though, because then you have like celebrity patients and you get a lot of influencers and like more famous people.
Mm-hmm.
But it really depends on like what kind of practice you want to have. Like I have a friend who works in Newport Beach and he has like a high-end practice, but he like does not want to work on these like influencers and stuff because they're so damn picky. And he's just like, I don't have the personality to deal with that. And I have that personality. I love dealing with these types of people because I am literally that type of person too. I'm like super picky.
Mm-hmm. There was another question. So what do you recommend a patient do if they're unsatisfied with their cosmetic work done, but their current dentist says it's the best they can offer?
Ooh, that's hard. So for me, when I'm doing cosmetic dentistry, I need to, before I cement everything in, I have them sign off on it just to make sure that they like it and that I have it in writing. Like you can't go back and be like, I changed my mind, I don't like it. Like, especially when do you do that sort of like if you're going to do refund, is after 1 year, after 2 years, they've been wearing it for 2 years and they go, I don't like it anymore. It's like, well, too bad, you paid for it, you signed off on it. And if your mind has changed, you can't just like put it on the dentist. But that is a hard question. I think every practice owner would approach that differently. What was the question again? Exactly.
What do you recommend a patient do if they're unsatisfied with their cosmetic work and their current dentist says it's the best they can do?
I think that when it comes to that, the dentist really needed to explain what their limitations are in delivering the treatment. And the patient also needs to understand what the limitations of the treatment are. So part of the way that my cosmetic, like the appointments go is appointment 1 and appointment 2 is actually designed so that me and the patient are on the same page. So that's what we call smile design, because I can create a smile that I want the patient to have, but ultimately what I want the patient to have is not what's important. You have to make sure that I'm giving the patient what the patient wants. And there needs to be a sort of like meeting where I start to understand more of what this patient thinks is beautiful. So we go through a whole process where I'll show them a bunch of different pictures of different translucencies of veneers, or I'll show them different types of shapes so that they can see that actually a lot of people are surprisingly overwhelmed knowing that there are so many different shapes that your tooth can be. And then I'll give them guidance. A lot of patients do need guidance as to what would look good on their face because they've only known what they have. So I'll give them a little bit of guidance. What we do from there on is called a wax up. So I will give all those instructions to the lab, and the lab will make me, let me see if I have an example actually. Oh. I'm at home, so. Okay, yeah. So the lab will actually make me a wax up, and a wax up is something like this. I took an impression of their teeth, and then they'll droplet by droplet. This is all just wax. You could just like scrape it off with your finger. They'll make like a mock-up so that the patient can see what things are going to look like even before I start drilling their tooth. That's really important. Like you don't want to just drill someone's tooth and be like, oh, I hope it comes back good from the lab. Like you want to be able to show them this is the direction we're going in. Are we on the same page? So everything is designed so that by the time they get their veneers, they kind of understand what they're going to get, and there's no major surprises. The worst thing is if you get a major surprise and it's your two front teeth and like you hate it.
Yeah, that would be really bad. That seems really interesting. I've never thought of like those first 2 appointments that you mentioned. It's such an important step to the entire treatment.
It totally is. And like I said, we can always assume what patients want, but the design process is really important in having their input to make sure that they're getting what they want. And also, it's a great way of being able to show them like, oh, maybe what you had wanted is not actually possible, but this is what we can do with the situation you have. We want to do as much as we can before we start drilling their teeth.
Yeah, that makes sense. So I have a question that's asking what kind of technology is used in the office. Maybe you could just highlight some of maybe like more modern technologies that you use in your office.
Yeah. Okay. So I think that the first thing that I have is kind of outside my office. The first thing I do is a virtual smile consult. So I started implementing virtual smile consults before COVID. Now it seems like a lot of dentists are trying to do virtual smile consults, but it's really been awesome to be able to just give people a really transparent evaluation of their smile and what they want to do. During that consultation, it's kind of like this, like exactly what we're doing. The patient will send me through there's like a link on my Instagram. They'll send me a picture of their teeth, and then I will break down for them exactly what I think that they need. Like they'll say, I hate my teeth. I want veneers. And then I'll break it down to see if one, that's even possible. And if it is possible, how much it'll cost and how many appointments it'll take. So those are the few things that people want to know when they come in for a consultation at your office. I think that by being able to deliver that and by offering that, it makes your practice a little bit different. It's more patient centric, because a lot of times when we do consults, we charge and we have to. Inside of a dental office, we have to, because we're paying for rent, we're paying for the assistant, we're paying for the front desk. By doing these virtual smile consults, I'm able to do it practically, for free for the patient and be really like transparent. I'm not selling them. I'm just telling them what I honestly think. And then if they want to move on with it, then they come to the office. So that's number one of the technology that I use. You start from the outside.
So you can do that without looking at an X-ray or anything, just a picture of their teeth?
It's only for cosmetics. So if they have like other things going on, I really can't help them. But it's everything that we do in the virtual space. And you guys know I'm very, very active on like Instagram, TikTok, and YouTube. Everything that we do in the virtual space eventually needs to lead back to our offices. So just because I said, it looks like you can do blah, 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 and blah, 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 by the time they come in, they have to know that I have to take x-rays. I have to do a actual clinical exam to make sure that we are still going to be able to do that, that procedure that I had recommended. But you can tell quite a lot by just looking at a picture. Like for instance, if someone wants veneers, there's going to be some dentist out there that will do veneers, even if their teeth are super, super crooked. But that's why the consultation is really important with different cosmetic dentists, because there are some dentists that will do it and there are some dentists that won't do it. It's not just like a one size fits all for everybody. So that's the first thing that I start with to differentiate my practice. The second thing that I have is a computerized anesthetic machine. So I've been getting a lot of questions about this computerized anesthetic, and I will post another TikTok or whatever on my Instagram. But basically, it's still a needle, but I call it as being syringeless, because what really makes people panic at the dental office is when they see that like silver syringe with the needle on it, the typical like anesthesia thing. That is what freaks people out. For some reason, the picture of seeing that like makes people really, really squeamish. So sometimes like if I have a kid, I will put that on the tray, and their eyes and their attention will be on the tray. And then I'll give them the injection with my computerized anesthetic, which just looks like a little pen. It's connected to the machine, and it just looks like a little pen. So I could just sneak it in there and go for it. It really does make things a lot more comfortable. And the reason is because when we're injecting, there are two things that hurt, right? One is the initial penetration, which I have a very strong topical. And so that topical just like is magic. And then I inject them. And then the speed at which the anesthesia goes into the patient is what hurts next. So let's say that I have one whole carpule of lidocaine and I push the whole thing in right away. The expansion of the tissue is what's going to hurt. But if I were to go slowly, droplet by droplet, you actually don't feel it going in. And so that is what ends up not hurting. And especially think about this. Take your finger and then feel the roof of your mouth. That area is way more tough than, like, let's say that I was going to inject like the side of your cheek. It's like soft and fluffy. So injecting the roof of your mouth, you would want to deliver anesthetic much more slowly than like a softer place. And the machine is incredible in that it can sense that and deliver it right at the right pace so that it doesn't hurt.
Wow.
The third thing I guess I have, I mean, my office is computerized, like totally digital, but I would say like the third thing that makes people, that really like people notice is our x-ray system. We don't just have digital x-rays, but I also have a portable x-ray gun. So what's nice is like we can take the x-rays and then we just take the gun and then we just zoop, and then we look at the screen to see if we got it. And you're probably like, that sounds just like the digital x-rays my dentist has. And your dentist may have it, but what's nice about that is that you don't have to run out of the room and press the button, right? When patients really appreciate this, by the way, is if you run out of the room to press the button, they freak out because it's like, why are they running out of the room? I thought you said this radiation's not that bad. So when you are just literally standing there with this little like toy gun thing, and then you just hit the button and it goes zoop, and they don't feel anything and it shows up on the screen and they didn't run out, it gives a lot more confidence to the patient. And then probably the last thing that I have is a scanner. It's a digital scanner and it has a lot of functions. I usually use it mostly for Invisalign consultations because it's connected directly to Invisalign, but I can also use it to take impressions of like a crown prep that I did or a veneer prep that I did. I also can just scan your mouth just for fun and see if you have any cavities with it because it has NIRI, which is like near infrared radiographic imaging. And that's really cool for patients who are like deathly afraid of having x-rays. I do require x-rays at least minimum every 2 years, but in between, it's nice to have other tools that patients can appreciate.
Those do seem really handy. So I have a question about dental school. So this one is asking, what activities did you do in dental school? So I think they probably mean like outside of, studying.
Yeah. Well, I didn't have that much time in dental school, to be honest. The 3-year program, dental school, is really fast paced. And I think for me, it was maybe a little bit too fast paced for my learning style, to be honest, because I'm like the type of person where I need to write my outline and then go to class and then write another outline and then I write it all over again. And like, it's just like, so it sinks into your brain really well, but like, it's so time consuming. So when you get to dental school and you start compounding all the different classes, like you just don't have the time to study like that anymore. I didn't do too much in dental school. I was part of like a Christian club, which we just meet at lunchtime. Probably the biggest thing that I did was we organized a trip to Fiji. It's a dental mission trip. So me and maybe 3 other people had fundraised for this. It's all student run. And then we led like 20 other dental students to Fiji. And then we were just getting our hands wet in Fiji. And it was really nice because the Fijians are so, so nice and accommodating. It's kind of like a work play type of situation where all day without AC. We're like drilling teeth, extracting teeth, doing amazing dental work. And it's a win-win because they need the dental work, but we also need the experience. And then afterwards, we go and jump in the pool.
That
So that
sounds
was
like
probably
fun.
the major thing that I did.
So was that like D3 year, your third year?
I did that during my third year.
Okay. Um, so there's another question. How did you know cosmetic dentistry was for you? Did you ever consider other specialties, or did you know that you wanted, well, you did mention that you didn't
Mhm.
advertise yourself as a cosmetic dentist at first, but
Yeah, that's a really good question. I think for me, it was like a process of elimination, right? When I was graduating from dental school, I was 23, and everyone told me like you should specialize because you are so young and you have the time to do it. And so during residency, when residency was over and I was starting to like go into private practice, I was like, oh my God, I'm not ready to go into the real world. And I was thinking maybe I should specialize. But I had tried all these different things and I didn't love it more than doing general dentistry. So at first I thought like, oh, maybe I'll do pediatric dentistry because I'm like a small petite Asian woman, and I was like, it would be so cute. And then I actually really ended up enjoying doing endo, which is root canals. When I was practicing, I was thinking maybe I'll go back to school and do that. But I couldn't imagine doing only that for the rest of my life. I liked the flexibility of being able to pick and choose what I wanted to do in the general realm. Then, for some reason, when I was an associate, I started getting a lot of cases that had to do with aesthetics, and I hadn't thought about doing a becoming a cosmetic dentist because I felt like in my mind I had a I had a figment of like what a cosmetic dentist is supposed to be. Like I thought like it should be like a Dr. Appa or like someone who's like really famous and only works on celebrities. And I was like, well, I don't want to just do celebrities. Like I actually don't want to do celebrities at all. I want to help everyday people just be their most confident selves and like transform them and just make them happy. And so I started doing that a little bit in private practice as an associate. And I realized I really like doing that type of dentistry. And so for me, it was kind of like a natural progression. The hard thing is, and you guys will find this too, is at what point do you start calling yourself a cosmetic dentist? Like, for a little bit, you're going to fake it till you make it, right? Because no one's going to ask you to do their cosmetic work if you're not if you're not really a cosmetic dentist, because people want to go to people who only do cosmetic dentistry. For me, because I didn't really want to do cosmetic dentistry right from the get-go, I ended up getting a lot of experience in cosmetic dentistry first, and then I decided I wanted to become or start marketing myself as a cosmetic dentist.
that's interesting. So another question is, what age group do you most commonly see for cosmetic procedures?
Age group, it depends what we're talking about. So like under the umbrella of cosmetic dentistry, there's bonding. Like you guys know what bonding is. It's just like when you take filling material and you just like you just glue it onto the front. There's that, there's Invisalign, there's veneers. And I find that the age groups are different for each of those different types of things. Like for bonding, I typically find that that's for younger people, like in the 20s and 30s. They don't want to make that huge investment for veneers. Maybe they want it in their future, but they just kind of want to put a little bit of like a band-aid, like they don't like something and they just want to put something on there for the time being. Then in the 30s to 40s, I do find that people are more ready to commit to like a veneer because I don't know, I think a lot of things happen in life. And like, for example, a lot of the people who end up coming to me are people who were moms, and they kind of like put everyone else first and then finally they are realizing they don't like their smile and they're finally putting themselves first. So it's just like that special age range where people really want to do something for themselves. Invisalign is funny because with COVID, I don't know why, we've had such a surge of people doing Invisalign at all ages. And what else is under cosmetic dentistry? Like white spot removal. I find that that's quite young. Young people want to do that because it's pretty conservative. But I still get people in their 30s who want to do that, who didn't even realize that that was an option until they saw like my TikTok video. Whitening is all ages, really. Whitening is all ages. Yeah, I think those are pretty much the major ones, right?
Yeah, that makes sense that different age ranges would have different frequency. So, a lot of people are asking about loans, and
Uh-huh.
so I see a question. Um, how would you go about, or I guess, what advice would you have for a dental student who just graduated and has a bunch of loans?
Advice for a dental student who just graduated and has a lot of loans. That was me. That was me. Okay, so here's the thing about student loans is that we all graduate with them. I also graduated with $325,000 of student loans, which I guess is a lot, but it's not a lot for it depends on the school, right? That you went
Mm.
to. Um, I was, by the way, very, very frugal in dental school. I didn't spend a lot of money, and it helps. It kind of helps when you're a girl and you don't have to buy your own drinks. But I was super frugal in dental school. Like I only ate like certain things, and I didn't buy like at the time when I was in dental school, like everyone had Tory Burch flats, and like I didn't go and buy Tory Burch flats like everyone else. Um, After dental school, you start to make a little bit of money, but you still have to be very, very frugal because it's not like the good old days when you get to go buy a boat right away. Like you have this huge debt to pay back. And it can be super, super like heavy and overwhelming because at this point in your guys' lives, and this was for me too, I didn't really have a concept of how much $325,000 was. And I couldn't even like break it down to how much I would be paying per month. And I didn't really realize how many teeth I would need to drill in order to pay that back. So there's like this whole process where you're like, oh my gosh, oh shit. Am I allowed to say that? Like you really like are stunned by how much money this is. And you're like, oh my gosh, how am I going to pay this back? The thing is, once you start working, you'll start to be able to save. You have to be smart from the get-go about how much money you plan to spend. You can't go ball out. Unless like your parents paid for your loans, but you really shouldn't be balling out because it's not your money. It's like something that you have to pay back. And at this point in my life, I am paying my loans back every month. I haven't paid it off. I'm only 10 years out of school. So I still have like what, 15 years left to pay back. It doesn't stress me out though, because it becomes one of the loans that you end up having to pay back as an adult. When you become a practice owner, you're going to have a practice loan too. If you have a car, you'll probably have a car loan. If you have a house, you'll have a mortgage. It just becomes another loan that you have to pay back in the grand scheme of your life. And you start doing it on autopilot. And instead, you start focusing on what you can do to manage your money and to save your money and to get ahead of this hump that we've like all put ourselves in to become dentists. So don't freak out. You will be able to pay it back, but you just have to be smart. You can't like spend money like your friends. Another hard thing is that when I was in dental school, I went to UOP, and it's very well known for having a lot of like legacies. And that means like people who their parents were dentists and their grandparents were dentists, and like everybody's a dentist, and they all don't really worry about money. And it sucks because when everyone else in your school is pretty well off and you're like just trying to hang out with them, it gets hard. But you have to remember that you're not in the same situation as them. You have to always keep yourself and your finances at top of mind because it's all money that you're going to pay back later.
Mm-hmm. It does seem really scary at first, but the way you're describing it, it seems like it just kind of blends in with all the other loans that you have to have as an adult.
Yeah, I don't think about it anymore. Seriously, I just put it on auto pay, and like if I think about it too much, I'll still freak out.
Okay, so this is, let me see. So this question is asking, what were attributes you had that gave you more confidence as your ability to become a dentist?
During the process of becoming a dentist, I don't think I had really confidence. I have to say that I don't know if it's because of my like Asian culture or whatnot. I always kind of lacked confidence. Even though I did well on my tests and I did well in school, I always felt like I wasn't doing enough. And there comes a time when you realize that that's actually a problem. Like when I graduated from dental school, it took me a while to realize that I was a good dentist, even though I am a good dentist. And you know, I have my own practice. I was a professor for 6 years. Like there are so many things that tell you that you are a good dentist, but confidence is one of those things that you have to continuously work at because it's an uphill battle. Why it's a problem is when you start owning your own business, if you don't have confidence to tell people to do certain things that they need, then, and you're always second guessing yourself, then you're not doing them a service. And not only that, you're competing against so many other dental practices, and those dentists are sometimes literally way worse than you or like they're not as good as you, or like they're not as conscientious, or they don't bring the same things to the table. I'm not saying all of them. I'm not saying like I'm the best dentist in the world, but you realize that confidence is a huge part of becoming a successful dentist and being a player in the game when the economy is so saturated.
That's a good point. Um, so let's see here. Okay, so this is back to dental school. What study methods do you think worked best? And do you have any advice for incoming dental students?
I kind of mentioned my study habits. I'm the type of person that I need to study slowly, like little bit every day. I'm a very, very diligent studier. I'm also I'm not like a textbook type of person. So I need to go through the textbook to outline things. I'm a very structural thinking type of person. So I need to go through the textbook, outline things. Then I need to watch somebody actually teach it to me. This is why I think it's very difficult for people. I feel so bad for everyone who's doing Zoom dental school, because that's like not the way that I learn. I can't learn through PowerPoint. I need to see a physical person like drill it into my head. And then after that, right away, I need to go back and like re-outline everything and use different colors. Again, the way that I do things is super, super inefficient, but it's just the way that I learn the best. It's like active learning. Otherwise, my brain completely shuts off and I won't absorb anything. Your question is advice for any incoming undergrads. If you're an incoming undergrad doing pre-dental, figure out what works for you. That was very difficult for me. When I was in high school, I had like a Stanford tutor. Like my parents were able to afford a tutor like that, and I had this amazing person to like teach me everything. And then when I went to college, I really struggled to figure out what my learning style was because I couldn't bring him with me. And I think I almost got a C in like chemistry. And I was like, I don't understand. I don't understand why I'm not able to get a good grade in this class. And I tried everything. Like my roommate, she would just cram all night. I tried that and I literally fell asleep during the test. So like you have to figure out when you do the best and how you do the best. My teacher, I went to his office hours and I was like, I don't understand. I think it's your class. Like, I don't understand why I'm not doing good in your class. And he was like, Joyce, you are so used to doing the bare minimum to get that grade. And he's like, science is a discipline and you get what you put in. So if you need to put in a little bit more time for you to get those good grades and to truly understand the subject matter, then you have to do that for yourself and stop thinking about like, oh, what's the bare minimum that I can do to just squeak by and get an A.
That's a good point. So I see a few questions asking about how you balance your practice along with your social media.
Oh, I don't know if you could even call it a balance. I'm like a completely imbalanced person, I think, but it works for me. This is how I stay like so excited about dentistry and everything. I started my social media in August of 2018, and I didn't even really know what social media was. I didn't know what a hashtag was. I didn't know how to use Instagram. I felt so old, but I knew that I had to go to where the patients are. If everyone's using Instagram and if everyone's on TikTok, that's where I should be. So I started going on there. It does become very time consuming because, to think of a new topic to talk about on your posts and show up every day, especially when you have other things going on in your life. Like, I don't know if any of you guys are like older and you guys have kids and families and like other obligations and school. And it's just, for me, I had a practice too. It's like hard to find the time, but I've found that it's so important to do this for me personally that I make the time to be on social media, because this is how a lot of my patients actually do find me. And overall, it's been such an amazing experience being on social media and being able to share. I think a lot of people think that they have nothing to share that people would want to listen to. And that's how I felt too. But it's the funniest thing. Like this whole week I've been sharing about how I like apples because
I
I'm
saw
pregnant
some.
and I've been like craving apples. And then people will respond like, oh, did you try this apple? Did you try this? It's just like such a fun way to interact with patients, potential patients, and just your community as a dentist. I actually was working 3 days at my practice, and then I have an associate one day. And then the other 2 days I was teaching at USC. And in the beginning of 2020, I left USC so that I could have those 2 days open so I could do social media and be a mom and also keep running my practice. So that's like the sort of the balance that I have. If it's ever becoming too overwhelming, I don't go on. Your mental state is a little bit more important than what you do on social media. And the most important thing is not just to like go on and be super, super active and then just die off. It's all about the long game when it comes to social media. So you'll notice that I show up every week. I may not be super, super active some weeks, but I'll show up every single week, at least one day a week on Instagram, just to remind people that I'm still around.
And that must take a lot of commitment to, like, get yourself to do that every week and stay active.
It is, but it's part of my life now. It's weird. It's sick. It's like part of my life. And again, like I was saying, everything that you do on social media at where I am at, it needs to convert to real patients in your practice. So if let's say that I'm spending all this time on social media, but there are no patients that are coming through to my practice, then what's the point?
And this is a question that's kind of related, but so how did you build up your client base as a cosmetic dentist? And I'm sure social media had like a role in this.
Definitely. When I took over an old practice, it's been around for like 50 years. It was basically the previous doctor was doing the same things I was doing, but he was dabbling in like root canals and implants and things like that. And when I took over, I didn't have that much of an identity as a dentist. I thought that I would continue doing all the procedures that he was doing. So I kind of started off with that. And the more that you start practicing, the more you start defining what you like to do. One of my biggest things about my career and how I stay so satisfied and why I love doing what I do is that I feel I retain the control over my career. So when I graduated from dental school, there weren't a lot of female Asian dentists owning practices, and it's becoming more and more common, but I didn't know where I fit into this career of dentistry, which is it's a very traditional career. There's like a lot of, when you think of a dentist, you think like an old white guy, but times are changing. And what I ended up having to do is take this career and make it my own. And that meant defining what I want to do and how I want to do it. And the more I keep moving on, the more I keep whittling it down and figuring out exactly what I have to offer patients and the procedures that I'm the best at. And so it becomes like you start taking the plunge and marketing yourself like that after you have enough experience and you've figured out exactly what you want to do. Marketing yourself is one of those things they don't teach you in dental school. And I'm very bad at marketing, actually. That's why I love social media, because in social media, it's a form of marketing, but I don't actually market myself. Like I never tell you guys like, come to my practice. I'm always just sharing about my own life. I'm very good at sharing about dentistry, my passion for dentistry, and like what's going on personally and why I would make a really good fit as a dentist. But I'm really bad at like selling things and like convincing people to do things. So that's why I love, love, love social media. It gives you like the opportunity to connect with people as people.
Mm-hmm. That makes sense. They don't teach dental students to be salesmen or saleswomen.
Yeah, it's actually like frowned upon, but you need some of that like ability in order to be successful.
Mm-hmm. Yeah, it seems like a dentist has their hands in a lot of different things.
Lots of hats.
Lots of hats. Yeah, that was the word. Well, Dr. Kahng, I think that's all the time we have for questions. Is there any like last advice you want to leave our pre-dental viewers with?
Yeah, do I? I don't know. If you guys have any questions, like I'm always pretty active on my DMs, Instagram, and then yeah, just send me a question if I wasn't able to get to a question here. But as far as like advice is just don't be so hard on yourself because I find that people in this age, like I've done a lot of these talks with like high school students, and I'm really always shocked at how much pressure you guys put on yourselves to figure out the perfect career for yourselves. And it's so hard because when I was in high school, who knew whether dentistry would work out for me? You really don't know until you do it, unfortunately. But I would say that at this point of my career, I don't think that there is just one perfect career. So if you keep your mind open to all the possibilities, like who knew that I would make money like doing Instagram? You know, sometimes the career that you think that you're going to end up loving doesn't even exist yet. So just keep an open mind. Don't be so hard on yourself and study really hard, be disciplined and all that. But yeah, you know, whether the whole dental thing works out or not, you just got to take it day by day.
That's very good advice, Dr. Kahng. Thank you so much. And thank you so much for answering all of our questions. I know those were a lot of questions, but we really appreciate all of your answers.
Of course. Thank you guys for having me. I always love talking with pre-dents. And then, yeah.
Yeah, thank you. And thank you everybody for watching. And I hope everyone has a great night. Bye, everyone.